If you have a severe allergy, you know the fear isn't just about the reaction, it's about the needle. Well, today we're looking at a breakthrough, 8 years in the making, that's designed to solve that exact problem and completely change how we handle a life-threatening crisis. You know, when a severe allergic reaction hits, the cure can feel almost as scary as the cause. So that brings up a huge question. What if we could take the biggest fear, the needle, totally out of the equation? And this isn't just a small issue. We're talking about millions of people, especially kids, who are just terrified of needles. And that fear, it leads to hesitation. In an emergency, every second counts, and that delay can be the difference between a close call and a real tragedy. It's a massive unmet need in medicine. Okay, so let's really dig into this dilemma. The problem isn't just about someone having their life-saving medicine on them, it's about whether they can actually bring themselves to use it in a moment of absolute panic. And when you look at the numbers, it's honestly shocking. Studies show that fewer than half of the people who are supposed to have an epinephrine autoinjector with them actually carry it regularly. And even for those who do, there's often this dangerous pause before they use it. And the consequences of that delay, they're devastating. I mean, every single minute counts. Waiting is directly tied to a higher risk of ending up in the hospital, having a second reaction hours later, and in the worst cases, a fatal outcome. But what if you could just remove that biggest barrier? What if you could get rid of the needle itself? That exact question is what led to the invention of a whole new kind of device. And this is it. It's called neffy. It's the result of an 8-year journey with the FDA, all to answer a pretty simple question. Could we make an alternative that was needle-free, super simple to use, and way less scary? So how does it actually work? I mean, how do you take a drug that's always been injected and make it just as good as a nasal spray? Well, the answer is in this really clever concept the developers call the proven triad. The strategy here is just brilliant. Instead of trying to reinvent the wheel, they just combine 3 things that are already proven and trusted. First, you've got epinephrine, the gold standard treatment for over a century. Then they added a safe FDA-approved ingredient called Intravale that helps it absorb quickly. And finally, they put it in the exact same super reliable spray device used in things like Narcan, which has a failure rate of less than 1 in a million. They took all these known, trusted parts and created something totally new. Okay, so this all sounds fantastic in theory, right? But it all comes down to the single most important question. When your life is on the line, is a nasal spray really as effective as a shot? To answer that, researchers ran multiple clinical trials. They looked at a really key metric, how much epinephrine actually gets into the bloodstream and how fast it gets there. And as you can see, when they compared it to the benchmark set by injections like the EpiPen, neffy delivered a concentration of the drug that was right in that sweet spot, exactly where it needed to be. And this is where it gets really crucial, because it's not just about how much drug is in the blood, it's about what the drug actually does in the body. So when they measured its effect on dangerously low blood pressure, neffy performed just as well, and in some cases even better than the injection. It gave a more robust and sustained response, which is precisely what you need in an emergency. This is the logical next question, right? If you're having an allergic reaction, there's a good chance you have a runny or congested nose. So of course, the researchers tested for that exact scenario. They put neffy to the test in people who had stuffy, runny noses from both allergies and just a common cold. And the result? It had almost no impact on how well the drug was absorbed. But get this, here's the really surprising part. Some of the data suggests that the body's own physical changes during an allergic reaction might actually help the nasal spray get absorbed even better. So after all those years of rigorous testing, of navigating the whole regulatory process, the story finally reaches its climax. And it's a huge milestone for millions of patients and their families. And here it is, the big moment. After that 8-year development journey, neffy got official FDA approval in August 2024. This is when it went from just being a promising idea in clinical trials to a real-world tool that doctors can actually prescribe. You know, this quote from the FDA's official announcement really just says it all. This isn't just another drug. It's a solution to a problem that's been around for a long time, that barrier between a patient and the treatment that can save their life. So what does this all mean for patients? Well, for the very first time, they have a choice. For adults and for kids over 66 pounds, there is now a needle-free option that's small,
portable, and designed to get rid of the fear that causes those dangerous delays. It's a tool that really empowers people to act fast and with confidence.
The arrival of Nafi really does feel like a new chapter. It's an innovation that solves a complex scientific problem, but maybe more importantly, it addresses a deeply human one. The real question now is how this new tool is going to change the way millions of people prepare for and respond to their worst allergic fears.